Next organism on our radar is the Fasciolopsis Buski. And the Fasciolopsis Buski, yeah, this is it. We have so many pictures of it. Where you guys will get to see that okay, you get to see the life cycle, the morphology, the transmission. Then if it is in an individual causing infections, what will be the symptoms, right? What is the diagnosis, how to treat infections from this Fasciolopsis buski. All right. So this Fasciolopsis buski is also known as a giant intestinal fluke. Why did they call it giant? This is because most organisms are microscopic, but this one, can you see how big it is? So for this side, is actually what? A giant compared to other microorganisms, all right? So it's a parasitic flatworm that affects what? Humans and pigs. Morphology is what? Is about 7.5 centimeters long. That's about 3 inches. The width is about 2 to 3 centimeters. That's about 0.8 to 1.2 inches, right? Thickness is about 1 to 2 millimeters. That's about 0.04 to 0.08 inches. Okay, life cycle. The eggs will be released in what? Feces of infected hosts. All right. So, wow, I didn't bring any picture on life cycle. Wow, that's crazy. But don't worry, we'll talk about it. I guys, you understand. So, if it is in a host, it will be released through the feces. Okay. These eggs, okay, will be hatched in water and it will release what? The Miracidia. So that means as a human being, if you take up contaminated water that has the eggs of this organism, you automatically what? Develop the condition, right? So the Miracidia will now infect aquatic plants like water chestnut, lotus, all right? So the Cercariae will now develop on plants, will now infect the host through ingestion. Do you understand? Like, let me say, if fish or anything, human beings, animals, cows, pigs come to the water side, either they drink the water directly or they feed from plants that are infected by this organism, they take up the disease condition, right? So the metacarria exists in intestine, right? When you take it in, it will exist. Do you know what is exist? Exist is now come out from the cyst and start developing. So it will mature into an adult fluke in your intestine. Okay. Transmission is through what? Ingesting contaminated aquatic plants or contaminated water, just like I've said. The side effect that it will cause in a human being or the animal is what? Abdominal pain, diarrhea, weight loss, nausea and vomiting, fever, intestinal obstruction, right? Diagnosis. Since we said it is first transmitted through the feces, so if you want to actually confirm this, you can do a stool examination of either the animal or the human being to find out for the eggs and segments of this organism. Imaging studies like CT scan, MRI scan can help to endoscopy and serological tests can also help. Treatments. You could use drugs like what? Praziquantel, albendazole, and niclosamide. Okay, all of them can work. Prevention, you should avoid contaminated aquatic plants. All right. Then proper cooking of plants, improve sanitation and hygiene, regular deworming of pigs. All right. Complications, all right, can lead to things like intestinal obstruction, malabsorption, allergic reactions, and vitamin deficiencies. Then lastly, the epidemiology. It is endemic in Asia, that's mostly in China, India, and Southeast Asia. Estimated number of people that have these infections from this organism include what? About 10 to 20 million infections worldwide. It's most common in rural areas with poor sanitation. All right. So I think that's it for the Fasciolopsis buski, also known as giant intestinal fluke.